And you worked for pharma companies, hospital, insurance system. How does this system influence the kind of care people actually receive?
So because of insurance and insurance coverage, I mean, many a times, even in India, in Middle East, the doctor will ask you, what is your insurance coverage? And you will show your card, your insurance package. And based on that, the doctor will tell you whether, you should get admitted to a hospital or not. Certain tests should be prescribed or not. Certain medicine should be prescribed or not. And at times, doctors do certain tests to rule out certain possibilities. But at times, they also do it because your insurance is covering and they get a fee out of it. I mean, it's not the right thing to do because many a times, because doctor prescribes tests, mentally you feel maybe there's something wrong. That's why the doctor is prescribing these additional tests to me. Most cases, it is not needed. I mean, I don't want to blame the doctors. They are doing their best to rule out anything. But at times, they are also driven by greed, and which is not the right thing to do. Even the insurance companies will, want to make sure that, you get adequate care. But on the other side, they are also, looking at the doctor and his management. And at times, the insurance companies will reject something which they should not reject.
That's true.
And which is not fair as well. Ideally, it should be more like a model where if the doctor is prescribing, instead of insurance rejecting, the insurance should check with the doctor why is it required. Get that from the doctor rather than rejecting it outright and making the patient feel on the lower end of the spectrum. Most patients will actually, if they can afford, they will pay from their pocket and get it done. Nothing wrong with that, but the doctor should be asked, why did you prescribe?
Yes.
Rather than rejecting it from the patient, the doctor should be questioned. The insurance premiums are paid either by companies or by the individuals.
Yes.
The prescription is not done by them. That is done by the doctors. If the insurance company is rejecting it, it should not ask the patient or tell the patient, it should tell the doctor.
I think that's a great point, especially as you mentioned, India still we have option, we can go to privately. But in the US, if I something is prescribed and my insurance said you cannot do it, we cannot afford it even you are a millionaire, right? Because the expense, Medicaid expense, and also it's very hard to get any test done without a doctor prescription, right? And if your insurance actually declined without telling, just to be as a patient, there was I remember that there was a case happen in Washington close to, I think, years ago, is the doctor prescribed for something for cancer for year and a half, but insurance declined, and then the person got his cancer was almost in third stage when they again did the test, and the doctor said, patient, I told you to do it, and he said my insurance declined that test. And this is very big issue, especially in foreign countries, when the insurance sometimes they just decline the test. I had in myself, I had I broke my arm, and then with my insurance, my husband insurance, we had surgery, but I was not able to get proper any physiotherapy. They are saying it is not included. So it's very hard to afford to be we cannot afford outside to go and do it. So I think this is the big gap. Insurance systems need to be improved. Almost